you look at the front cover of newspapers across the country this week, or watch cable news each day, it's pretty clear that the rhetoric on health care reform is really heating up. Whether it's threats from the other side of the aisle to, quote, break a president who's made health care reform a priority, or whether it's the million-dollar ad buys from interest groups we are seeing, or whether it's political pundits, health care rhetoric is really reaching a fever pitch. In fact, the discourse here in Washington, D.C. has gotten so loud that the voice of American families is being drowned out. These days, those who need reform the most are the ones being heard from the least. That's why 3 weeks ago I sent an email to many of my constituents asking them to share with me their personal stories of dealing with our healthcare system and ask them for their ideas for reform. So far, I have received, in just a few short weeks, over 5,000 emails into my office with deeply personal and often very painful stories from every corner of my state. Yesterday, I came to the floor to share several of those stories. They were the stories of women who had lost their insurance, and due to an inability to get care when they needed it most, they lost their lives. Many of the letters I've received, like those I spoke about yesterday, tug at the heartstrings. But today, this evening, I want to talk about what so many Americans are concerned about right now, their purse strings. Mr. President, I understand that many Americans are satisfied with the level of care that their insurance provides. These are the Americans who can get in to see a doctor when they need one and they receive good quality care. These are the Americans who want to know what's in it for them. What will I get out of reform? And with all of their other problems, why should we pay for it right now? These are good questions to which most American people deserve a good answer. Mr. President, it's not just the uninsured who are impacted by not being able to access preventive medicine or having to seek costly care in the emergency room. These costs get passed on to those with insurance in the form of higher insurance premiums. In fact, it's estimated that a family of four today here in this country is paying an added $1,000 in premiums a year to help cut for those who don't have any coverage. Essentially, families with health insurance today are paying a hidden tax. That tax is hurting our families who are insured, and it's hurting our businesses, and it's got to end. Healthcare reform will do that by creating a competitive pool of insurance options, including a public option. We can bring down the costs and the premiums to families in the long run. We're going to be moving to a system that rewards innovation and healthy outcomes. And because Americans will have a choice of insurance plans, insurance providers will be forced to lower costs so they can be competitive. The existence of a pool of insurers to choose from means that if you lose your job, you don't lose your insurance. If you want to change jobs, or maybe even start a business, there's a healthcare option for you. And we make it easier for small businesses to provide coverage for their employees by having them pay for up to half the cost of health insurance for businesses with 50 or fewer workers. Importantly, we also prohibit insurance companies from charging higher premiums for women or for the elderly, and we end the practice of denying coverage to those people with pre-existing conditions. And for the first time, we put a priority on prevention and wellness. If we invest in community-based programs to improve nutrition or prevent smoking or increase fitness, we're going to save taxpayers nearly $16 billion a year within 5 years. So healthcare reform, when we talk about it here, will make healthcare coverage more affordable, more portable, and undeniable. Mr. President, let me just give a real-life example of exactly someone who has health insurance today, but who will benefit greatly from the healthcare reform that we're talking about. One of the letters that I recently received is from a woman named Patricia Jackson. She lives in Woodinville, Washington. And I suspect Patricia's story will sound pretty familiar to most Americans. Patricia and her family have private insurance that's paid for each month through premiums that come directly out of Patricia's paycheck. But as in the case with many middle-class families, the burden of those premium payments is rapidly rising. To provide for her family of four, Patricia paid $840 a month in 2007, just 2 years ago, $840 a month. Last year, her payments jumped to $900 a month. Today, she is paying $1,186 in premiums just to provide for her family each and every month. Unfortunately, for many families, Patricia's story isn't the exception, it's the rule. It's exactly what they're seeing in their homes with their premiums. Health insurance premiums for working families in Washington State have skyrocketed in recent years. In fact, according to a study by Families USA, from 2000 to 2007, premiums increased by 86.6%. Let me say that again. Over an 8-year period, premiums in my home state of Washington increased by 86.6%. But over that same period of time, wages in my state only grew by 16%. So health care premiums are taking a bigger and bigger chunk out of families' paychecks. Health insurance premiums rose over 5 times faster than median earnings, and that problem is just not going away. For a lot of our just average middle-class families today who are struggling to make their mortgage payments or send their kids to college, this is a situation that cannot continue. They can't afford it. So if we don't have meaningful health care reform, it's a trend that is going to continue indefinitely. So, Mr. President, I think this is reform that can't come a moment too soon. Just 2 weeks ago, in fact, Patricia, who I just talked about, her insurance company, the largest private insurance company in my home state, announced another dramatic increase in premiums. And they told Patricia and a lot of families in my state that starting on August 1st, 2 weeks from now, the company is going to raise premiums for 135,000 enrollees by an average of 17% more. 17% more from what I just told you. We had a front page story in our main paper, the Seattle Times, the day after that hike was announced. It quoted a woman by the name of Gail Peterson, who lives in North Seattle, who said that means her premiums are going to rise by $300. She said, and I quote, "Would love to see the insurance companies have a little competition." Well, Mr. President, so would Patricia Jackson. In fact, Patricia recently contacted my office again to let me know that starting on August 1st, her new premiums will be over $1,400 a month. That is just unaffordable. It is unsustainable for Patricia, for America's families, for our businesses, and for America's future economic strength. Mr. President, health care reform isn't just for the uninsured. It's for people like Patricia and Gail and the millions of others who have health insurance right now, played by the rules, but whose paychecks and futures are being gouged by a system that lacks accountability, and lacks competition, and lacks reason. Unfortunately, now we are hearing some of our friends on the other side who want to prevent meaningful, comprehensive reform from ever moving forward. Just as unfortunate are their motives. Mr. President, we heard a member of our Senate who said who wants to protect the status quo, and he said, quote, "If we're able to stop Obama on this, it will be his Waterloo. It will break him," unquote. Mr. President, that type of posturing is playing games with real lives and real people in order just to score cheap political points. Blocking health care reform won't break the President of the United States of America. It will break American families. It will break American businesses. It will break the bank. America deserves better. Mr. President, Congress knows that most Americans like their doctors, they like their providers, they like their coverage. On the days they need to see a doctor, they're glad that they can provide their families with coverage for booster shots or checkups or preventive or even emergency care. But on payday, very different story. So, Mr. President, for those of our colleagues who ask how we can afford to pay for this, I'd like to tell them to ask Patricia Jackson. or any of their constituents, because the real question is how can we afford not to? Especially at a time when the economy is struggling and the cost of this care is rising, we need to do everything we can to rein in these costs, prevent people from losing their coverage and having to seek more expensive care in our emergency rooms. Tonight, we're going to hear from the President of the United States. He knows, as so many of us do, doing nothing is not an option. The time is right, the time is now. Patricia and her family and the millions of hardworking, tax-paying Americans across the country can't wait any longer. So I urge our Senate colleagues to set aside the rhetoric, begin to look at the issues and help us solve the problems so we can move this forward.